Here's something that will shock you. The same cup of coffee that medical researchers say can reduce your risk of dying from heart disease by 31% might also be the reason your blood pressure medication isn't working. And if you're over 65, your body processes caffeine 33% slower than younger people, which means that afternoon coffee could still be affecting your heart at bedtime.
If you're feeling overwhelmed by conflicting health information about coffee, you're not alone. One day we hear coffee is a superfood that prevents Alzheimer's and protects our hearts. The next day, we're warned it spikes blood pressure and causes anxiety. For seniors especially, this confusion is maddening because we're trying to make the best choices for our health, but every expert seems to say something different. You deserve clear, honest information about what coffee really does to your aging body. And that's exactly what we're going to explore together today.
If this is the kind of conversation you've been looking for, please take a moment to hit the like button and subscribe. Your support is what makes these in-depth discussions possible. And don't forget to hit the bell icon so you never miss our next big topic. Now, let's get into our first big topic.
Let's start with what mainstream medicine tells us about coffee and senior health. Major medical institutions consistently report remarkable benefits. Recent large-scale studies involving hundreds of thousands of participants show that moderate coffee consumption, defined as 3 to 5 cups daily, is associated with reduced risks of cardiovascular disease, type 2 diabetes, and stroke. The Harvard School of Public Health published findings showing that coffee drinkers have lower rates of heart failure, and Johns Hopkins research indicates coffee may protect against Alzheimer's disease, which affects nearly 2/3 of women in America. The medical establishment points to coffee's high concentration of antioxidants and polyphenols, which fight inflammation and oxidative stress. They cite research showing that coffee consumption correlates with longer lifespans and reduced mortality from leading causes of death. Some cardiologists even suggest that the anti-inflammatory effects of coffee may be strongest in the morning when inflammation levels naturally peak in our bodies. Recent studies from 2024 and 2025 have been even more encouraging. Research published in the Journal of Clinical Endocrinology and Metabolism found that people who consumed 200 to 300 milligrams of caffeine daily were significantly less likely to develop multiple cardiometabolic diseases simultaneously. That's roughly 2 to 3 cups of coffee. The researchers found that coffee consumption could play a protective role in almost all phases of cardiometabolic disease development. But here's where it gets interesting. When you talk to actual seniors about their coffee experiences, you hear a very different story. Many report that their doctor told them to cut back on coffee because of blood pressure concerns. Others describe feeling jittery, anxious, or unable to sleep if they drink coffee past noon, something that never bothered them when they were younger. Some seniors say their heart palpitations improved dramatically when they switched to decaf or reduced their intake. Healthcare providers often tell patients with hypertension to limit coffee consumption because studies show that older adults who drink 3 or more cups daily have measurably higher 24-hour blood pressure readings. In clinical practice, doctors frequently observe that seniors taking blood pressure medications struggle with control when they consume significant amounts of caffeine. The reality is that aging changes how our bodies process caffeine. Research demonstrates that adults over 65 metabolize caffeine 33% slower than younger people. This means the same amount of coffee that someone has been drinking for decades now has an amplified and prolonged effect. The caffeine from a 4 p.m. coffee might still be circulating in a 70-year-old system at 10 p.m., potentially disrupting sleep patterns and increasing nighttime blood pressure. But here's where there's another layer to this story that most people don't know about: the medication interaction issue. This is where things get really complicated for seniors. Nearly 100,000 adults aged 65 and older are hospitalized every year due to drug side effects, and coffee can interact with many of the medications that seniors commonly take. Let's talk about some specific examples. If you're taking blood thinners like warfarin, which millions of seniors do, caffeine can slow blood clotting even further, increasing your risk of bleeding and bruising. If you're on thyroid medication, like levothyroxine, drinking coffee at the same time can dramatically reduce the medication's absorption, making it significantly less effective against symptoms like fatigue and weight gain. For seniors taking certain antidepressants, coffee can reduce the amount of medication your body absorbs by about 1/3. And if you're on medications for diabetes, coffee can increase blood sugar levels in some people, potentially counteracting the effects of your diabetes drugs. The American Medical Association notes that seniors are particularly vulnerable to caffeine-related anxiety, heart palpitations, and sleep disturbances. Unlike younger adults who might experience these effects only with excessive consumption, older adults can develop these symptoms with what would be considered moderate intake for younger people. Here's what's really concerning. Many seniors don't realize these interactions exist. They've been drinking coffee their whole lives, and suddenly their medications aren't working as well, or they're experiencing side effects they can't explain. The coffee that once gave them energy and seemed harmless might now be interfering with their carefully managed health conditions.
Here's something most people don't know. When you drink your coffee might be just as important as how much you drink. Groundbreaking research published in early 2025 in the European Heart Journal revealed a striking pattern. Seniors who consumed their coffee only in the morning hours, specifically between 4 a.m. and noon, showed a 16% lower risk of death from any cause and a remarkable 31% reduced risk of dying from cardiovascular disease compared to non-coffee drinkers. But here's the crucial part. These protective effects completely disappeared in people who drank coffee throughout the entire day. The researchers believe this timing effect relates to two key factors. First, drinking caffeinated coffee early in the day doesn't disrupt sleep patterns the way afternoon or evening consumption does. Quality sleep is absolutely critical for cardiovascular health, especially in seniors. Second, coffee's anti-inflammatory effects may be most beneficial when they align with our body's natural circadian rhythms. Let me explain what happens to your sleep when you're over 65. Your circadian rhythm, which is essentially your body's internal clock, becomes less efficient as you age. Many seniors already struggle with falling asleep earlier and waking up earlier than they used to. This isn't just a preference change, it's a biological shift that affects every senior differently. When you add afternoon or evening caffeine to this already delicate sleep system, you're asking for trouble. Studies show that caffeine consumed even 6 hours before bedtime can significantly disrupt sleep quality, reducing the total sleep time and particularly affecting the deep, restorative stages of sleep that seniors already get less of naturally. Here's what's really fascinating. Research from the Journal of Clinical Sleep Medicine found that caffeine taken 6 hours before bedtime reduced sleep by more than 1 hour, even when people didn't feel like the caffeine was keeping them awake. For seniors who metabolize caffeine 33% slower, this effect could be even more pronounced and longer lasting. But let's talk about the very real risks that many seniors experience, starting with sleep disruption. Sleep problems are incredibly common in older adults, with studies showing that 50 to 70% of people over 65 have symptoms of insomnia. When you add caffeine to this mix, especially later in the day, you're potentially making an already challenging situation much worse. Poor sleep in seniors isn't just about feeling tired the next day. It's linked to increased risk of falls, cognitive decline, depression, and cardiovascular problems. When your sleep is disrupted by caffeine, you're not just missing out on rest, you're potentially accelerating other age-related health issues. Now let's address the blood pressure issue more deeply. Studies specifically focusing on older adults with hypertension found that those consuming 3 or more cups daily had significantly higher systolic and diastolic blood pressure readings throughout the entire 24-hour period. This isn't just a temporary spike after drinking coffee. This is sustained elevation that persists even between cups. A study from Spain that followed over 700 seniors with hypertension found that heavy coffee drinkers had a 45% higher chance of having uncontrolled blood pressure despite being on medication. Think about that.
Nearly half of the seniors who drank 3 or more cups of coffee daily couldn't get their blood pressure under control even with medication. But here's another concern that many people overlook: bone health. This is particularly important for senior women who are already at higher risk for osteoporosis. Caffeine increases the amount of calcium you lose through your urine. For every cup of coffee you drink, you lose about 4 milligrams of calcium. That might not sound like much, but research from the University of South Australia found that people consuming 800 milligrams of caffeine, that's about 8 cups of coffee, had a 77% increase in calcium loss through their urine. Now, most seniors aren't drinking 8 cups of coffee, but even at lower doses, this calcium loss can be concerning, especially for postmenopausal women who are already losing bone density due to hormonal changes. Some studies suggest that the calcium loss from coffee might contribute to increased fracture risk in older adults who don't get enough calcium in their diet. There's also the dehydration factor that many seniors don't consider. While coffee itself isn't dehydrating, if you're replacing water intake with coffee consumption, you could be contributing to chronic mild dehydration. This is already one of the leading causes of hospitalization among adults over 65. When you're dehydrated, your blood pressure can spike, you're more prone to kidney stones, and your cognitive function can decline. Additionally, certain brewing methods matter more for seniors than they realize. Unfiltered coffee made with French presses or Turkish-style preparation contains compounds called caffeine that can raise LDL cholesterol levels. This effect doesn't occur with filtered coffee, but many seniors prefer these unfiltered brewing methods without realizing the potential cardiovascular impact. The medication interaction issue becomes even more complex when we look at specific drug categories. If you're taking medications for anxiety or sleep disorders, caffeine can directly counteract their effects, making it harder for these medications to work. Some seniors find themselves in a cycle where they drink more coffee because they're tired from poor sleep caused by their evening coffee consumption. For those taking heart rhythm medications, caffeine can potentially cause dangerous interactions, leading to irregular heartbeats or palpitations. Blood pressure medications might be less effective in the presence of caffeine, requiring higher doses or additional medications to achieve the same control. Perhaps most concerning is that these effects can be cumulative and subtle. You might not notice that your coffee consumption is gradually making your blood pressure medication less effective or that it's contributing to your sleep problems until the issues become significant enough to require medical attention.
After examining all this evidence, here's what we know for certain. There is no one-size-fits-all answer to whether coffee is good or bad for seniors. The research clearly shows both significant benefits and real risks. And the key is understanding which category you fall into based on your individual health profile. If you're a senior who has been drinking coffee for years without adverse effects, and particularly if you limit your consumption to morning hours, the evidence suggests you may be gaining significant cardiovascular protection. The key factors appear to be timing, keeping consumption to before noon, moderation, limiting intake to 2 to 3 cups daily, individual tolerance, paying attention to how your body responds, and most importantly, medication considerations, working with your doctor to understand potential interactions. However, if you have uncontrolled blood pressure, experience anxiety or sleep problems, take medications that might interact with caffeine, notice heart palpitations or jitteriness, have concerns about bone health and adequate calcium intake, or struggle with dehydration issues, then the risks may outweigh the benefits for you personally. Let me share some practical guidelines that emerge from this research. If you're going to continue drinking coffee as a senior, consider these evidence-based recommendations. First, limit consumption to morning hours only, ideally before noon and definitely not after 2 p.m. The timing research is too compelling to ignore. Second, stick to filtered coffee when possible, as unfiltered methods can raise cholesterol levels. Third, if you're taking any medications, have a specific conversation with your doctor about timing.
Some medications should be taken 30 to 60 minutes before coffee, while others might need to be taken at completely different times of day. Fourth, monitor your sleep quality carefully. If you're having trouble falling asleep, staying asleep, or waking up too early, your coffee consumption might be contributing to these issues, even if you don't feel jittery. Fifth, consider your calcium intake. If you're not getting enough calcium from your diet, the calcium loss from coffee could be problematic for your bone health. Adding milk to your coffee or ensuring adequate calcium intake from other sources can help offset this effect. Sixth, stay hydrated. Make sure you're drinking plenty of water throughout the day and not relying on coffee as your primary fluid intake. Seventh, be aware that your caffeine tolerance may have changed as you've aged. The amount that used to feel fine might now be too much for your system to handle efficiently. Here's something important that many seniors don't realize. You don't have to make an all-or-nothing decision about coffee. Some people benefit from switching to half-calf or decaf versions while still getting some of the antioxidant benefits without the full caffeine load. Others find that reducing from 3 cups to 1 cup in the morning gives them the benefits without the risks. The goal of our discussions isn't to give you definitive medical advice. That's your doctor's job. Our goal is to help you ask the right questions when you talk to your healthcare provider. Questions like, given my current medications and health conditions, what's a safe amount of coffee for me? Should I be concerned about the timing of my coffee consumption? Are my blood pressure control issues related to my caffeine intake? Would switching to decaf provide some benefits while reducing risks? How does my coffee consumption affect my sleep quality? Am I getting enough calcium to offset any losses from coffee? Could my coffee intake be interfering with my medications? Your individual health profile, medication regimen, and how your body responds to caffeine are far more important than any general study results. The research gives us valuable insights, but your personal experience and your doctor's guidance should ultimately determine what's right for you. Remember, the coffee industry and health research are both constantly evolving. What we know today might be refined or even changed by future research. The important thing is to stay informed, pay attention to your body's signals, and maintain open communication with your healthcare team. Make sure you're subscribed and have notifications turned on for more evidence-based health discussions like this one. If you found this content helpful, please give it a thumbs up, and if you have related good information or personal experiences to share, please leave them in the comments below. Your valuable comments and likes give us tremendous motivation to keep creating these videos.